question so that we understand the current situation. Before sending ordinance, because you're pushing for it, may datos kita nga mahalinan, nga inventaryo, kung pila sa mga kabataan naton ang apektado sining Autism Spectrum Disorder. May ara bala kita baseline data available or wala gid?
That is also one of the... Madam Chair, if I may answer the question of the good gentleman. Madam Chair, if I may answer.
Yes, please answer.
Yes, it is also one of the component of the ordinance that the implementing office, the City Health Office, will keep record of the data as it comes for those that will be screened by. But right now, I don't think there is a data the city has for ASD children, and I think the special SPED, they have enrollees, or they have children that are with special needs, but I am not aware if those children were properly diagnosed or assessed. Madam Chair.
Just to add, for your inquiry, Councilor Cabaluna, actually, though may ara, tatlo lang na organized na organizations nga nag-look into sa ila. One is, you mentioned SPED, and at the same time, ang Tawag Project sa City Government, ara na sa CSWDO, sa MOLO, and then the Autism Society of the Philippines, Iloilo Chapter. Though so far, do mo pa lang ni sila ang tatlo gid nga organized organization nga may ara sila members. So I think pwede naton makita ang data nila.
Yeah, so even more reason why we should pass the ordinance, no, kung wala kita baseline data to start with, like pila ka porsyento sa mga kabataan natin ages 18 and below are suffering from ASD, no. Kahit ako nga bagay nga I don't know if I use the right term, suffering man nagyapon, no. So dapat balanta na. I think one of the early nga mangin result indicators in the ordinance will be that, no, establishing the inventory and data. How far in terms of capacity now within the city government, up to what level? I see a lot of words nga referral diri, pero sa aton capacity available, technical capacity, capability available, ano lang sarangan natin maubra sa ining mga ma-identify natin?
Madam Chair, if I may.
Yes, please answer.
Right now, no, ang the way I see it, no, ang nakita ko nga ang capacity lang sa city or with this ordinance is for referral only. No, kay ang therapy is also is quite expensive, Madam Chair, and ang purpose of this ordinance, actually ang una ko pass for first reading was only for ASD, but during sa committee hearing, dito na ibaluan nga ASD is one only of the neurodevelopmental disorders. So gin-push ni CSWDO in the person of Ma'am Centeno, Mary Grace, that ginamba niya, Councilor, why not himonto na lang other neurodevelopmental disorder, i-include ta kay ang guaya, Madam Chair, nga kung may mapadiagnose bala, no, sa aton nga mga, let's say sa consultant, so kung hindi siya gali ASD, hindi siya pag-diagnose, so do amo na ang rationale. So amo na gin-include nato na lang nga ang all neurodevelopmental disorders, kay ang ADHD is one also of the isa lang sa ang ASD isa lang sa mga NDDs or neurodevelopmental disorders, no, including also ang cerebral palsy, considered man nga NDD, ADHD, learning disorder, communication disorder, motor disorder, conduct disorder. So damo siya gali nga mga disorder, Madam Chair, no, nga under this, no, ang pinakababaw gid amo na ang tawag naton nga neurodevelopmental disorder. So do amo na siya, do umbrella lang, no, one of lang ang ASD, Madam Chair.
Madam Chair, no nga ti referral anay kita subong but we're looking forward nga someday bala mayara kita bulig kay nakapalabot man isa ako ng isa kinikanan nga budlay gid mag-raise ang bata nga may autism, especially mo manambal mo pagluwas nga kilanlan mo expert magastos man, no? So mabuligan ta sila ta kung nga bagay nga kung may numero na kita mabalaan ta the urgent need kung kadamo gali ni sila so pwede ta maalukaran makakuha ta mo tong inambal ni Councilor Rex nga mga makontrata ta nga mga experts to help us alleviate some of the costs sa aton mga ginikanan nga ginasupera, no? Last question ko lang, Madam Chair, no? I know this early detection ang imo handom, no? Wala tayo plano sa mga above 18 nga may amumani may what do you think we do with them as well? Ay kadamo man base sa amon na may mga ADHD, mga ano are there although early detection yung goals ng ordinance, but is any plans in relation to those who are also in the spectrum that are also part of above the age of early detection?
Madam Chair, if I may, no, I have a resource speaker in the person of Dr. Silina Hilyada. She's here right now, and I think she can answer those technical questions, Madam Chair. So Dr. Silina is one of the two only developmental pediatrician based here in Iloilo City. So Madam Chair, if I may I suspend the rules so that our resource speaker can answer questions that are technical in nature. Madam Chair.
Yes.
So
Rules are suspended. Yes. Hi, Doc. Good afternoon. Ay, good morning pa lang.
Good morning. Good morning, everyone. Thank you for the invitation. It's long overdue for children with developmental disorders, I think. So, thank you for the invitation. I am very happy and glad that this ordinance is being proposed now in the city government, because I know that in some other cities, they already have a program on this. As you all know, it's early childhood is the most critical period to identify children with developmental and behavioral disorders. And the earlier that we identify them and we can start them on intervention, then they will have better outcomes, they can perform better in schools, they will have maybe the opportunity to hold a job later on and all these things. So, hindi man tanan nga may developmental disorders, is what do you call this? It's yes, they say it's a lifelong disorder, but because of early intervention, a lot of them now are said to be ang balgan nila subong kuno may ara nga na nagagwa na sila, they are no longer they don't already show the symptoms of autism and other developmental disorders, and this is because of early intervention, no? And when we say early intervention, we hope that we identify these children as young as 3 and up to 5 years old. Na amo na siya ang purpose naton sini. And well, regarding this program, as I mentioned, it's difficult to engage the services of the subspecialists. There are only 2 of us here in the region now, kasi naglain na ang Negros, no? I was the first. I've been here for like 24, 25 years practicing already the subspecialty, and I feel like I'm only seeing the tip of the iceberg, no? You know, good thing that in some municipalities they have budget. The local government would provide budget for the children enrolled in their special needs education classes in their government schools, and they are sent to us. The government would, other LGU would support them, would provide resources so that they can be seen by the subspecialist. So this has been going on for several years already. For the city, I would see patients mostly from the centers and referrals, of course, from our SPED, ISEC, and other private schools and institutions here in the city. Currently, if you ask me for the exact numbers, well, we don't have. Our society, the Philippine Society for Developmental and Behavioral Pediatrics, we don't have the exact number, no? But the Center for Disease Control, who does the monitoring of this, last 2023 had stated that the prevalence now of autism is 1 into 31 children. So below 8 years old. So that was
Big number.
2 years ago, and 2 years ago when I made my lecture, it was 1 in 46. After 2 years,
Wow.
1 into 31. So we don't know. The increase might be because of increasing awareness. Parents are more aware. Teachers are more concerned about their students. So that's why nga they are being nadadiagnosed and identified. So this is very timely. DOH is also working with us now regarding this. DOH Western Visayas, we had a meeting last week. They want also to put into some programs regarding this. And and our society actually is attending the committee hearings for both the Senate and the Congress to push some other legislation regarding this. Thank you.
Thank you.
Questions?
I would just reiterate just my final question, and I'm glad nga Doc Calyada is here, and the fact that we have one of the champions of the region. Doc, I know this is early detection. Ano mo lang tong last question ko, the rest you have expounded beautifully. Ang above 18, wala na bala kita maobra sa ila? And this is early detection there, but I'm sure some of our problems here, even crimes.
Is reacting.
Yeah.
Malay mo yung mga crimes ni mga threats ni recently, these are also grounded upon a lot of the neurodevelopmental disorders that you mentioned.
Yeah, exactly.
So I'm just gonna ask that, what intervention can we do for those above 18? For below 18, early detection and referral. But for above, ano ang aton?
I will refer them to a psychiatrist.
Sige, Doc. I submit to your expertise. Thank you, Doc.
Okay, before that, si Councilor Yang earlier, may question?
I'm asking the proponent if the mention of Section 5 residing in the Iloilo. So what do you mean as modified residents of Iloilo, just transient or just residing? So
Madam Chair, the ordinance is for the residents of Iloilo City, and there's a provision sa aton ordinance ginbutang da nga ang committee composed of the mayor as chairman, and there are members. The vice chair is the city health officer, and also there are members. Formulate sang IRR for the implementation of this ordinance, but the focus ng ordinance ang aton nga mga residents there sa city, Madam Chair, and